Good evening, everybody. Sorry for the delay. As is sort of norm for these days, we had a little bit of a technical glitch. Hopefully, we're all back on track, and we're appreciative of you joining us tonight. We will try to make up some time along the way. We understand that there's a vice presidential debate tonight that several people want to try to attend. And so I also want to make sure that we get to plenty of times for our question and answers with our panelists, as we have several local and national panelists here that I'm sure that you would like to hear from. So I'll go ahead and dive right on in. Next slide. So our agenda tonight, I will take about 10 to 15 minutes to walk you through Milwaukee Repertory Theater's safety plan. Our managing director, Melissa Vartanian, will start a panel discussion with our experts, and then we should have time at the end for some question and answer. Next slide. So much like probably most of you, we're trying to figure out our way through a global pandemic, which is obviously an unprecedented situation for us as theater leaders. And we're looking to both local and national sources on how we can navigate this current situation. Locally, if you're not from the state of Wisconsin, Dr. John Raymond, who's the president and CEO of the Medical College, is kind of like our local Dr. Fauci, and people look to him for advice and to see it is where we're going. And he gave an interview just a couple of weeks ago indicating that he does not anticipate the need for continuing severe lockdowns. Specifically, he did caution that we have to still respect the virus. It's very risky. We all know that. And yet, as the pandemic has evolved, we've gotten a lot more information, a lot more strategies on how to mitigate the spread of it that will allow certain sectors of our economy to start to reopen. Next slide. Like many of you, I've been glued to Dr. Fauci since the beginning of this. And sort of, if you're in the theater world, sort of famously, Dr. Fauci said some comments about a couple of weeks ago about how the return to normal theater going habits won't happen until basically Q3 of 2021. That all caused us, as you can imagine, a lot of concern, and particularly as we see the field sort of get decimated by this virus. And then Dr. Fauci circled back and he actually clarified what he meant by a return to normal is pre-COVID normal, meaning no masks, no social distancing, any of that sort of stuff. He did not mean to say that theaters will be shuttered until the end of 21. In fact, he actually said that he could see the opening of theaters happening soon, as long as we paid attention to the virus mitigation strategies that the CDC has recommended, as well as local and public health officials. Next slide. So that's where we're at right now. So the 2021 season reset at Milwaukee Repertory Theater. This is a transitionary period between pre-COVID, which is the normal environment. We're working towards a return to the normal environment. But right in the middle, we're going to have to have a period of time where we're reopening, but with strategies that allow us to do so in a safe manner. But it's not going to be normal. For those of you musical theater fans out there, I am referring to this as a next to normal stage. So what does this mean? Really, there's 5 strategies that we're looking at. The first is we're looking at small casts with limited production and live performances. We're looking at socially distancing audiences and performers. We're requiring the uses of personal protective equipment. In the state of Wisconsin, our governor has issued a new declaration that requires that, but even if there isn't a declaration that requires it, we will require it as an institution. The fourth is significantly increased cleaning and disinfecting. And the fifth is rigorous COVID testing, tracing, and isolation protocols. And I'm just going to dive a little bit into each one of these strategies. Next slide, please. I want to say a quick thank you. This is the safety leadership team at Milwaukee Repertory Theater. Outside of the staff, we really had 4 primary advisors: Dr. Needfeld, who you'll be hearing from this evening, Dr. Benjamin as well, Mr. Phillips, who is an attorney, and Mr. Hunsinger, who is the president of Hunsinger Construction. Together, they represent expertise in medical, public safety, legal issues, as well as facilities and HVAC sort of issues as well. I also want to say a quick thank you to the Milwaukee Rep leadership team at the bottom of the slide. Every single one of these people have spent an enormous amount of time in the last couple of months putting this plan that you're about to see together. Next slide. So first, our season reset. We had a 2021 season that we knew that we just could not produce safely. So we picked up that entire season and we moved it down the line to season 21-22. And then we handpicked shows that we knew that we could produce primarily with safety in mind. First and foremost, we want to make sure that our staff, our artists, and our audiences are safe. We know that we're able to produce these shows with limited production elements, socially distanced performers, and with small casts. They can be experienced by our audiences either in person or virtually. We know that COVID statistics are going to go up and down. Some people also have very individual and unique circumstances. So we want to make sure that we're meeting them where they're at and they have access to our productions in either a live, in-person, or virtual means. These productions were also financially viable with significantly reduced ticket sales. Currently, we will only be selling a very reduced amount of our capacity. And so our projected ticket sales are 10% of what they normally would be. So we needed to make sure that it was financially viable. And fifth, and probably the most important to us as a theater, we needed to make sure that we can produce them at a world-class artistic quality for which we are known, as we do not want to damage the brand, as we have a very strong brand locally and nationally. Next slide, please. Strategy 2 is social distancing. Our theaters are going to be reduced to 25% of their capacity. You can see a seating chart now on our website that shows exactly how we're spreading out audiences. Audiences are not going to be allowed to select tickets that sit next to each other in groups. We have specifically blocked off seats that force them into social distancing. This may increase to 35% if conditions allow, but at the moment it's going to stay at 25%. There will be no seating in the front row. This is to make sure that there's an appropriate amount of distance between the performers and the audiences. The performers themselves on stage will also be socially distant. There are no pre or post-show events, so unfortunately we're not going to be able to do rep in depth, or they're not going to be able to do donor meet and greets that just introduces too much risk for virus spread, and so we have eliminated those. We've also eliminated intermissions and food and beverage. The idea here is that we do not want any more opportunities for patrons to bunch together. As long as we can keep them spread out, the safer the environment is going to be for all. So that means, at least for the 2021 season, our Donors Lounge, as well as our Stackner Cabaret, which is our restaurant that we operate, are both going to be closed for the season. All of this meets or exceeds city and county and state regulations, as well as the recommendations for the Centers for Disease Control. Next slide. So strategy 3 really has to do with PPE and health screening. Our audiences and staff are going to be required to wear face masks at all times. Staff and artists are also going to be instructed to stay home if not well. I know many of us in the theater industry have this the show must go on sort of attitude. We've got to really shift our mindset away from that and make sure that we're encouraging staff and artists and patrons to really stay at home if they are exhibiting symptoms. Health questionnaires are going to be sent out to patrons in advance pre-performance. We go through this process every day with staff. So daily, staff will have to answer health questionnaires about their risk and exposure to the virus. We are taking temperature checks for every audience members, as well as artists and staff every time that they enter the building. Next slide, please. So strategy 4 is all about cleaning, disinfecting, and airflow. We have invested in 4 Clorox 360 machines. These are the machines that many airlines are using right now. They're an electrostatic sprayer. Basically allows us to disinfect our entire theater complex, anywhere that the public audience is going to be before and after each show. It allows us to get to places where you just can't, by human nature, get to and sort of wipe down or sort of disinfect. So this reaches every single surface that are in our theater complex. You'll see hand sanitizer stations all over public areas, encouraging people to disinfect their hands and to wash their hands. We have significantly increased cleaning staffing, added on day porters and other staff just to make sure that everything is continually to be cleaned regularly. High touch items, those are like door handles or anything that you would touch constantly. Those are going to be disinfected multiple times during a period of an hour. We are looking to reduce high touch items as much as we possibly can. So we have eliminated playbills. We will email playbills in advance to attendees so they can peruse them. We will not be doing paper tickets. We will be going to all digital tickets. Patrons will be scanning their tickets on their own. We will have staff nearby to help, but we are there to assist and to reduce basically contact between individuals as much as possible. You'll also probably be hearing about this later, but we have replaced and increased our filters. And so now we're using MERV 10 and MERV 13 filters to reduce the particulates in the air, and so that our HVAC system is as safe as it possibly can be in terms of particulate spread. And then, of course, we are also increasing airflow and fresh air turnover. Fresh air is very important as we try to recycle or increase the airflow so that we don't have contaminated air. So each one of our venues will be flushed with fresh air on a regular basis. Next slide, please. So strategy 5 is all about testing, tracing, and isolation. We are creating the basics of an artistic bubble. So basically what that means is that all of our artists, designers, anybody that's coming in from the outside, that we're going to ask them to test in advance before they get on the plane. Once they actually get here, they're going to be tested again. So pre-arrival and post-arrival testing. And then everybody that has access to our artists and our artists themselves will go through serial testing at least on a weekly basis. This is to make sure that we're not introducing the virus into our artistic spaces as much as we possibly can exclude it. The access to the rehearsal hall is going to be very strict. I would only say maybe a handful of people are going to have access to the rehearsal hall, and all those people are going to have their own entrances, their own exits. They're going to be credentialed to have access to the rehearsal hall, and so we're limiting that space as much as possible. We've also moved our rehearsal hall into our STEMKey studio because it's a much larger space, so we can socially distance more and we can flush it more with air. Our accommodations for out-of-town artists is close enough to the theater that they can walk. Again, we're trying to limit exposure, so we're not introducing any need for public transportation. Our artists and our actors can order groceries to have delivered, and we are putting in protocols to make sure that we reduce any sort of exposure for them outside of the rehearsal studio and their normal everyday activities. If we have a case of COVID-19, we have detailed plans, depending upon who it is that is diagnosed and who it is they come in contact with. But the basics of it is that if we have a positive test, the first thing that we're going to do is we're going to make sure that that person obviously gets the medical attention that they need quickly and properly. And then we're going to go back through and we're going to look at who that person was in contact with. We have logs and we can figure out with contact tracing who also might need to be tested and who needs to be isolated. And the person obviously has tested positive will go into isolation. We will monitor them medically just to make sure that they're doing okay. And they will follow the CDC guidelines before they actually are brought back into work. And then, of course, we will go through a deep cleaning and sanitization process as well. You'll probably get more details on this from Melissa and Dr. Niedfeld later on in the panel of experts conversation. Next slide. So I think the biggest thing, though, as we look at our safety plan is to acknowledge that public health is a team sport. Everybody has to be working in the same direction. The weakest link can introduce the virus into this atmosphere. And so all of us are being trained at the staff level to be highly mindful of what it is that we're doing both in our professional lives as well as our personal lives to make sure that this space is the most safest possible space for our actors, audiences, and patrons. I just also want to say a really quick thank you to our union partners. We've worked with every single one of them to make sure that we have a really strong and safe safety plan. That's Actors Equity Association, IATSE, United Scenic Artists, the Stage Directors and Choreographers Society, and the International Union of Operating Engineers. So a big thank you to them. Next slide. For updated information on our COVID-19 practices, protocols, or anything else, I would ask that you go to our website.
Good evening. Thank you to everyone for joining us tonight. Again, we're really sorry for the delay. I'm Melissa Vartanian. I'm the Managing Director here at Milwaukee Rep, and I will be moderating this evening. Before we jump into the questions, I want to give the panelists a chance to introduce themselves to you. So what I'm going to do first is I'm going to introduce them one by one and then give them each like 30 seconds to a minute to give a little brief bio about their background. So first up, I'm going to do this in alphabetical order. We'll have Jared Clarkin, who's Milwaukee Rep's COVID-19 Safety Coordinator and also our Director of Production. Then we'll have Carl Mueller, who's the business representative for live performance with United Scenic Artists, Local 829. That's the union that represents the designers that we use for our productions. We have Dr. Mark Neufeld joining us, and also Phil Vetterkind, who's the Director of Sustainability at Hunsinger. So I'm going to go ahead and toss it to Jared and have him give a little brief bio.
Thanks, Melissa. My name is Jared Clarkin. I'm a Director of Production here at Milwaukee Rep. I've been with the company for about 6 years. Prior to coming to Milwaukee Rep, I worked for a few other arts organizations here in town. And before that, I spent about 10 years in New York working for companies such as Jazz at Lincoln Center, Soho Rep, as well as touring internationally with the John Jasper Dance Company and Basil Twist's Symphony Fantastique.
Great, we'll toss it to Carl.
Hey everybody, it's really nice to be here. Thank you for asking me. I'm Carl Mueller. I'm the business rep for live performance at United Scenic Artists, the union that represents scenic artists and designers in live performance and film. Before I took my job at the union about 10 years ago, I was an agent. And before that, I was a production manager and general manager at Playwrights Horizons and Arena Stage. So I've seen both sides of the business, and I like to think that gives me a unique perspective on what I do as a union rep.
We agree. And we'll toss that now to Dr. Neufeld.
Good evening. My name is Mark Neufeld, and I'm a physician, family practice sports medicine physician here in Milwaukee, actually in Mequon. I've got a solo practice. I've been dealing with a lot of COVID over the past 6 to 7 months, trying to figure out things. I'm a team physician with the Brewers, so this past season, getting planning with Major League Baseball, getting the team ready, and actually pulling off a season in a relative community type situation, which we were really the first sport to do that. So that was part of what we were looking at doing here with the Rep.
Great, thank you. And Phil.
Hi, I'm Phil Vetterkind. I'm the Director of Sustainability for Hunsinger Construction. I'm a lead accredited professional as well as a well-accredited professional. I've been with Hunsinger for 18 years. And right now, basically all things sustainability is my role, which includes obviously wellness is in that as well. So right now, I also manage one of our professional service divisions called Sustainable Building Solutions, where basically I manage and I help other companies go through, basically green and wellness certifications like Energy Star, LEED, WELL, Fitwell. So there's a lot of options out there, but obviously recently in the last 6 months or so since COVID, been focusing a lot on especially the health and wellness and especially how it relates to indoor air quality and how that affects our clients.
All right, thank you all for joining us. So just for the attendees, so you understand how this evening's gonna work. First, you're gonna notice at the bottom of your screen that there's a question and answer function. What I'm gonna suggest is that while I'm going through some prepared questions that I have for the different panelists, if things come up that spark some questions for you, just go ahead and enter them into the question and answer section. As we go through this, we anticipate that those questions are going to come up. We want to make sure that we have time at the end for them. We aren't positive we're going to be able to get to all the questions, but the sooner we have them in there, the easier it is for us to filter through them. And then at the end, we will do our best to get through as many questions as possible. All right, I'm going to go ahead and start out with some questions, and I have one for Dr. Mark Neufeld. First, Dr. Neufeld, I want to thank you for all of your contributions to our safety plan. From the perspective of a licensed medical practitioner, it was imperative for us to have that perspective in our plan. You were instrumental in helping us come up with the testing protocols that we have for our artists and staff directly involved with the rehearsal and performance process. So we're very grateful for that. Can you tell me, in your opinion, what are the key items in our safety plan that will help mitigate risk to the patrons and the artists? I know that that's a big question that's come up for patrons and artists, especially when we get into performance mode.
Sure. I think I'll start with the artists. This is very similar to what we've done in athletics, is the same thing as to have a situation where we know that we don't have a COVID positive artist or staff member coming into, as Chad mentioned, sort of our artistic bubble. So that involves the testing pre-arrival, testing immediately upon arrival, and then serial testing. This is shown to be effective in athletics. This is exactly what we did in Major League Baseball, was pre-testing, relative isolation, and then serial testing throughout the season. And we were very successful in pulling things off. A couple blips early on, but once the players realized that this was a big deal and that you couldn't go sit at a casino and not have a problem, things worked out fine. So I think from the perspective of the artists and the staff, I feel very good about what we have in place, where we know people have 2 negative tests, most likely within 48 to 72 hours, which makes the risk of missing one, a false negative, extremely low. These are PCR-based tests, so our accuracy, our positive accuracy is excellent. We're not going to miss any positives. And if we have 2 serials, we're really not going to have any false negatives. So our artistic bubble initially is going to be intact. And then we are going to rely on people being responsible. And with proper motivation, I think we see that people can be responsible and will be. So I feel very good about it from the artistic perspective and our artists and staff. Certainly, I think for most of the people tuning in, the bigger concern is our patrons. And what do we do to keep our patrons safe? Key things I looked at and with this plan is certainly enhanced cleaning is going to be a big thing, so that we have a situation where you're entering a theater. Anybody who's been on a plane, and I have been, planes are cleaner than they've ever been. They're using the system. It's excellent. The airports are cleaner than they've ever been. And I think you'll see our theater, it's going to be cleaner than it's ever been before. So that's going to be step 1. Step 2 is we know that the artistic bubble is intact. So we don't have a situation where there would be spread from our staff member to a patron. And then really the third is going to be patrons coming in. And really, as we look at this, what we're seeing is the social distancing in the theater. If we look at the map, we have everybody social distance. And we're seeing this in some sporting events now. We're seeing, college football and the NFL are allowing some fans in socially distanced fashion. And that's really what we're looking at, is people being socially distanced. Masking, so wearing face coverings is going to be effective. And if both people are wearing face coverings and with an interaction, that's going to greatly reduce things. If we put that into a situation where it is not only both people wearing face coverings, but in addition, they are socially distanced. And in addition, we have a theater that is clean, and we don't have any chance of spread through inanimate objects. We're creating a situation really that is as safe as it possibly can be, given our current situation.
Great, thank you for that. I'm going to toss this next question to Carl. Carl, well, first, as we mentioned, Carl's the business rep for the designers and the designers union that we work with. And Carl, United Scenic Artists and other sister unions have been very diligent in working with theaters to create the safest possible conditions to return to work. We've gone back and forth with a lot of different iterations of our safety plan, if you will. What unique safety concerns does USA have, and how have we at Milwaukee Rep collaboratively worked with you all to solve them?
Sorry, I was muted. First thing that I would throw out there is exactly what Dr. Neufeld said. It's testing. It's all about testing. It is what we are finding on the movies that are starting. We have about 30 films that are in production now in New York, and it's all about a testing regimen. So the first thing we look for in any plan is a testing program and protocol, which Milwaukee had a very robust plan. We also look at issues around quarantine or isolation. What happens if somebody is exposed or has a false positive or an inconclusive test? What fences are put around that person or that situation? Like our sister unions at Equity and STC, we're very concerned about travel and housing. And, you know, one of the other really big things is that there be a COVID compliance officer on site who is, in a way, the neutral person that both the artists and the staff members can go to if they sense someone's not wearing a mask, someone is not socially distancing, someone is not, you know, there needs to be that neutral, in very much like an HR person, that the designers and the actors and the director know they can go to in a situation that they don't feel comfortable. The designers have a few unique situations that Milwaukee has addressed quite well, such as costume fittings. How does the costume designer be in close proximity with an actor to fit that costume? How do you lay hands on an actor in a fitting? And also sound, microphones, A2s, who are the technicians. How do you deal with all of those unique situations? And we've been very impressed with Milwaukee Rep and the fact that you've taken into account all of those situations and tried to address them to the best of your ability.
Thanks, Carl. It was
Sure.
a really collaborative process, and we appreciate you and the union going back and forth with us on that and helping us to see, you know, where you needed some extra work done, and we were happy to do it because we want to make sure that everyone feels good about coming back. Phil, I have a question for you. So Phil, some believe that COVID is transmitted through aerosols, making upgrades to HVAC systems pretty important. Can you talk a little bit about how we worked with you and how the HVAC system in our theater complex has been changed or enhanced to mitigate risk?
Yeah, absolutely. So basically, I think I mentioned before too, but in the last 6 months, a lot has changed in my world, and a lot of businesses are trying to figure out what are they going to do to their buildings to basically be able to open up and try to help keep their people safe. And one of those things, obviously, is HVAC systems and the indoor air quality piece of that. So the good news is in that time, we've had a lot of these organizations, these professional organizations that specialize this come out with their COVID information. So one of those would be, the CDC obviously have their recommendations on how to handle indoor air quality, but one of the ones that I like to look at is ASHRAE, which is American Society of Heating, Refrigeration, Air Conditioning Engineers, right? So they put a lot of those standards out there, and they came out with one and recommendations, some of the talking about things like filtration of the air, the run times of your system, the outside air percentages that you're using, basically how much recirculating air you should use and exhaust. So all those type of things, they put some standards out, which helped us. Other things we looked at too, there's others, basically COVID and these other systems out there, like the International Well Building Institute put out a new, basically I'll call it a rating system, a little more holistic, including indoor air quality. Fitwell now has a viral response module where you can, we're also more inclusive, but definitely a big part of that is your indoor air quality. So the reason I bring those up is we look to those standards to help us decide how do we now evaluate the system as it exists, and then what are we can do to improve on it. So some of those things, we do have an aging system in this building. It's not a new building, so it's not new. But one of the good things we do have is we have a good building automation system that was put in years ago. So we do have good controllability over the HVAC system. So one of those things that we can address with that is our run times. So how often are we actually running our HVAC system and running air through the filtration system. And so before COVID, we'd only have it running maybe an hour before occupancy or something like that, and probably afterwards, close it down like 15 minutes after occupancy. We're now basically, that has now been switched to pretty much running all day. And because what we've found is the more you can run that system and the more air you're bringing in and more filtering, the lower your particulate levels are. And so with that, and the next important piece of that is changing our filters. So prior to COVID, we had MERV 7 filters, pleated filters. Well, now we have bumped that up to not only MERV 10, but MERV 13 filters. So once again, though, something that we're observing really close is because we do have that aging system, we have to be a little bit careful with what filtration and that we're not taxing the system and that it can handle those. So it's something that we're definitely observing quite a bit. And not only that, but we're changing out the filters much more regularly. We were going from a quarterly changing out filters to now we'll be probably weekly. At least we'll be definitely observing them weekly and see if it's in time for a change. So that's something that's going to definitely help the system. And after we did that, we then brought in a third party air testing. So we actually brought in basically an organization that does air testing, and we basically we had sampling throughout the building, and we're looking for those particulate levels. And so we did one with the system off, and then once we fired it up with the new filtration. And what we're finding is definitely when they're off, we had some a low particulate number, which actually was good. But then once we ran the system, the filtration, we could tell obviously was doing what we had expected it to do, that we were getting a really low particulate count, which was really important for us. So that was good. Another piece of it, outside air. So the ASHRAE standard asks for, we should try to increase our outside air production because obviously outside air is good, right? And so with our building automation system, we're able to adjust that. Now, however, this is obviously also depending on your outside air temperatures. So in other words, if it's below 0, it's hard to bring in a bunch of outside air when you have to heat it up. I'm going to turn my lights off. So what the system is, so we are a little bit dependent on air temperature and humidity levels, but what we found is depending on those temperatures, we can go anywhere from 10 to 100% outside air coming in the system. So also a good thing and something that we can improve upon our system. And the last thing is the building exhaust. So obviously the more air we are exhausting is a good thing too, because that means you're turning over your air, basically more fresh air through your air handling unit. So what we've done is actually they're going to be cleaning the ductwork and the fans there to increase our exhaust of air. So those are, we basically got to touch on all of the recommendations from the ASHRAE and these other standards that I mentioned too. So we're pretty happy with where we're at with that.
Thanks, Phil. A quick follow-up for you. I know there's been a lot of conversation about bipolar ionization. Can you discuss from your professional opinion regarding that idea and discuss why Milwaukee Rep has not currently chosen to go that route?
So yeah, great question. So that's something that obviously has become very popular, especially just in the last, I'd say 2 months. There's two things that we definitely looked at is obviously, well, the other one is UV ultraviolet cleaning of the ductwork too. That's something you see more in a residential application, but still something that was talked about and maybe it was an option for us. And the other one that, yes, is the bipolar ionization. What we are seeing that used quite a bit right now. We're seeing it in a lot of local schools. A lot of local businesses are kind of trying it out. And we did bring in reps. We, through a lot of research and obviously, what we found is it's not cheap. So it was partially cost, but because of the other things that we could do with our system, not only the increasing the filters, we felt that probably, I'll call it our bang for our buck, really wasn't there because we had the options to do those other things that we felt that, the technology is, I don't want to say it's a little unproven or it's, so we weren't 100% confident or comfortable putting that in. There's obviously other worries with that system that you potentially could bring in ozone to the building. So, we wanted to be on the safer side on that. And like I said, we know a lot of businesses are doing it. And, but at this time we chose to not do that because we had the other options.
Great, thank you. Jared, I have one for you. As one of two COVID safety coordinators at Milwaukee Rep, what is your role and how are you working with Milwaukee Rep staff to keep everyone safe, or as safe as we possibly can?
Sure. So we're looking for any opportunities to mitigate risk. Myself and Emily Hill, our HR supervisor, both have gone through training through Health Education Services. So we are card-carrying COVID-19 compliance officers. And we're really working with the staff to empower them to make sure that they keep an eye out for safe practices happening in the building. We have hand sanitizers and signage all over the building. Mask wearing, as we've said before, is mandatory. So making sure that folks are checking in on other people and just, friendly reminders for folks to keep their masks on. As we transition from a homework environment, which most of our staff have been on, to being back in the building, it's an adjustment for folks, and, keeping an eye on everybody is really key in this process. But we've set up entrance protocols into the building. So there's a list of questions regarding your potential exposure to COVID, as well as a temperature check before entering, and various other things, limiting the number of people in elevators, and as we mentioned before, more deep cleaning throughout the building.
Great, okay. I'm going to push back to Mark Neufeld, Dr. Neufeld. Okay, I'm going to preface this by saying that we understand that nothing is 100% safe, so we can make no guarantees. But the most frequently asked question that I get when I'm out in the community and talking to friends and family and other patrons that I know is it really safe to return to the theater? Understanding that everyone has unique circumstances, what are your thoughts as a medical professional when it comes to that question?
You're exactly right that it has to be an individual decision. And, I think everybody has to look at their own comfort level, their own risk profile based on what we know. And if people have medical conditions, if somebody is immunocompromised, it may not be time for you to come back. However, I'm going to be back, and I think that for the vast majority of our patrons, that certainly the things we have in place, the measures we have in place, are making this a situation where, for the majority of people, it's going to be safe to come back. What we're seeing with this virus, when you start to examine things, and again, sifting through the research, sifting through data is extremely difficult, and certainly there's a lot of disagreement in things. But what we're seeing is that the generally healthy population is just fine. This is not measles. When we look at the R naught of this virus, measles is an aerosolized virus with an R naught of 12 to 18. This virus, again, depending on who you read, is somewhere between 2 and 5. So significantly lower. I think it's probably closer between 2 and 3. So the risk really is low, and especially when you take into consideration the distancing that we have in place for seating, the wearing of masks, and also the probably the most important thing is the questioning before you come. If you are sick, don't come. It's as simple as that. If you have any type of symptom, if you've got a cold, if you've got a sniffle, if you're coughing, if you've got a fever, by all means, do not come. And when I talk to people and employers and my own patients, that's the advice I'm giving them. What I am hearing is from employers who have situations where they have, 200 people working in fairly close quarters, simply doing symptom checks before people come to work has virtually eliminated the spread in their situation. Seeing that live, seeing that from these businesses makes me feel very comfortable in a situation where we have people coming in for an hour and a half, 2 hours, socially distanced, wearing masks, that this, for the majority of people, is going to be a safe situation.
Thank you. Thank you. I think it's important that we all do take that moment to sort of check ourselves. And we all have to think about that as staff members when we're coming in, that it's not just push through it anymore. It's now thinking about who else am I potentially putting at risk if I happen to be carrying the virus. So it's important for everyone to sort of think about that as they're going about whatever they're doing. Carl, I'm going to kind of come back to you. I had a planned question, which I think you kind of touched on when you were talking before, but maybe we'll just revisit it again. USA has endorsed our safety plan, and what I'm wondering is, what were the key elements of our plan? You sort of touched on testing that made USA feel most confident about our plan to reopen, and what are the other things that you're looking at when you're evaluating plans from all the theaters that are coming into you?
You know, the thing that I'm the most impressed with this webinar is what each of my fellow panelists have said, because it comports with everything that we are doing, both as an employer and with our employees, and also to put our members back to work safely. We have 5,000 members, and probably 90% of them are out of work. But they're slowly going back. And what Dr. Neufeld said, what Jared said, what Phil said, they're exactly the things that we are facing every day. We have an industrial hygienist on staff. Phil, I applaud you for everything you said about the filters and the art. It's exactly what we're telling people. You can't do everything. And
excellent. I'm logging off.
Yeah, no, but I think it's what we really liked about Milwaukee Rep's plan. I mean, number one, it is a comprehensive plan. The first thing we look for from an employer is this a soup to nuts, from what happens at the beginning to the time the audiences come in the theater and leave. Our members start working months before an audience ever enters the theater. What is being considered for their work ahead of time? What is being considered when they have to travel to Milwaukee? Is their housing being considered? All of those aspects. And the thing that has most impressed us with Milwaukee and Milwaukee Rep and a couple other regional theaters is how comprehensive the plan is. The second thing that really impressed us was the straightforward and honest answers to the questions. We put something out there and said, I'm looking for like one of them. We talked about, excuse me, how often will the COVID officer be on site? And the immediate response was, this is what we're doing. This is how it is. This is what will happen when Ms. Hill isn't there. I mean, the responses were thorough, direct, and complete. You know, we say to our members, the other thing that, one more thing, the flow chart. I'm looking at the flow chart. The flow chart is really good. And going back to what Dr. Neufeld just said about, you know, is it safe to come back? I will, Melissa, share with you a document, a flow chart that our industrial hygienist made, which is very much similar to what the doctor is saying. When is it safe for me to go back? We have our members ask us all the time, is it safe to go back to work? So we created a flow chart, which is, do you have an underlying condition? Do you have someone elderly or young at home? You ask these questions and you make the decision for yourself that I'm ready to go back. What we liked about Milwaukee Rep's plan is you seem to have taken all of that into account as you developed a plan. It's not for one piece or this thing, it's comprehensive. And that's the most important aspect that we look for.
Thanks for that, Carl. I think it's important to also say that it took a team of us here. It's not something that I think you can just charge one person with
No.
and say, hey, go figure this out for our theater, go figure this out for our organization or our business. It took a team of people because we all have different understandings and different aspects of the job that we're all doing as well. So we needed help to so we brought professionals to the table, and we also needed to make sure that we were all using our collective brain power together and coming up with ideas and problem solving. What will we do when this situation happens? What will we do when this situation happens? And how will that affect all these other things? So it was a very big team effort, and we're just grateful that you all on the panel have collaborated with us this far, and that the unions have as well. Jared, I'm going to throw this one at you. I think this will be sort of our last one before we tie right into the question and answer period. Milwaukee Rep invested in the Clorox Total 360 system, and Chad talked a little bit about those electrostatic sprayers. Can you tell us a little bit more about the system and when and how often it's going to be used in our public spaces?
Sure. So I'll try to not sound like an infomercial for them, but this is a pretty amazing piece of equipment. I was a little skeptical at first when they brought the machine in for a demonstration, but it works. The basic premise of it, it expels a fine mist of disinfectant, and right before that mist leaves the machines, the particles are electrostatically charged. So essentially, when that mist encounters any object, be that a seat, a hand railing, the electrostatic charge on those particles wraps everything around the item. So you can be standing in front of a piece of like a hand railing and spray it, and that spray will get into every little nook and cranny. And the way that we do it is you spray it down and let it sit for up to 2 minutes, and that will kill most viruses. So we've got 4 of these machines that will deploy around the building, focused mainly in our rehearsal and performance venues. And we've created schedules so that, for instance, during tech, we occupied the theater to do rehearsal in the afternoon. And then we have, I believe, about 2.5 hours built in to be able to disinfect the entire room with the Clorox Total 360 system before we allow our guests into the room. So, like I said, it takes about 2 minutes or so for the material to dry. And as soon as you're done spraying, it's safe for people to walk into the room. These are going to be employed into a rehearsal hall as well, so that we can make sure that those areas are disinfected on a regular basis. They have more information on their website too, if you want to check that out.
Great. Thank you, Jared. All right, I'm going to roll into some of these questions that we have in our question and answer section. All right, I'm going to just roll it out there and we'll see who can answer it. How have you adjusted your timelines for production work? Is there more time for build, load in, et cetera? Are departments working separately? What are the big changes? Jared, I'm going to throw that to you.
Fantastic. So yeah, we've scaled back the size of sets that we build specifically to allow ourselves more time and to space things out. We have a fairly large scene shop and about 3 resident crew members who work in that area, so they're able to space themselves out quite a bit. We've also adjusted approaches to things. So we're going to employ a rep lighting plot so that we do not need to change over all of the lighting equipment show after show. We will be staggering crew calls. So there may be a crew that comes in the morning and works through till the afternoon, and another crew that comes in the afternoon and works until the evening. We're really focused on mitigating risk wherever possible. So spacing people out, employing any machinery for heavy lifting that needs to be done. So we don't need to gather a large amount of people around scenic elements to get them into the air. Again, all of our staff members go through that screening protocol before they come in. So we try and address any symptoms before they make it into the building.
Can I jump in on that for 1 sec, Melissa? Just to
Sure.
say, Jared's exactly right, and I will say, as the union business rep, that this was a struggle for us because it means that less of our members will work. Um, a rep plot means less lighting designers will be hired. Less scenery means there could be less people hired. But if it keeps them safe and it opens the theaters, it will eventually mean more work for all. And that is the goal. I think that the challenge that we face across the board is the reality is these protocols are going to take more time and probably cost more money. And so we have to support the employers, Milwaukee Rep in this case, in doing whatever they can to open their doors because it is a give and take situation. And the only way it's going to work is if we get the doors open and get the shows running.
Thank you. All right, here's one that I think maybe I'm gonna kind of pre-direct to Dr. Mark Neufeld. What about if a patron has a case of COVID? Will there be a way you can trace that? Will you ask them to report it to you if they test positive, say the day after attending a performance? If a staff member tests positive, will you include patrons in your contact tracing? So I know that we did go through a lot of contact tracing conversation with Dr. Neufeld. I'm going to throw this to you.
Well, I think the thing to understand, and really the key thing, is what is a significant contact. So if we look at it, and if it's, I pass somebody, on a stairwell 6 feet away, that's not a significant contact. A significant contact is going to be typically less than 6 feet, no mask for more than 15 minutes. Some now are saying even, wearing a mask under 6 feet for 15 minutes could be a significant contact. So in looking at this, I think if we look at a staff member, the chance of a staff member having a significant contact with a patron is going to be extremely low. Certainly our staff members could have significant contacts with each other, but again, the strategies that we have in place, even for that were just discussed with, Jared and Carl, that's going to really minimize the significant contacts among our staff, which is the key. And then among our patrons, really, when we look at it, if you're sitting with somebody and they test positive during a performance, yes, that's absolutely a significant contact. If somebody was in the theater and they were in section 1 and you were in section 4, that's not a significant contact. If you're in section 2, not a significant contact. So I think that's going to be the big thing, and the chance of patrons who did not attend the performance together being a significant contact by health department definition is going to be extremely low, and a staff member having significant contact by health department definition with a patron is going to be extremely low. So I think we, as much as you can, and that's again why we do these strategies of distancing and masking and trying to avoid this close contact for prolonged periods of time, is to avoid that significant contact. Certainly, if a patron came in and said, for some reason was sitting with somebody that they didn't know, which again, it really can't happen in our system unless they do it on purpose, then I think that would be a situation where that person would absolutely be a significant contact, with that. So I hope that answers it. I'm not trying to be obtuse at all. It's just looking at the definitions, and really it's got to be a time-based, a distance-based, and then the face covering are all things to try to mitigate the chance of a significant contact. So even if you rode in the elevator with somebody, the elevator from our powerhouse level to G3 or 4 takes all of 30 seconds. So if you were in the elevator with somebody, that would not, by health department standards, be considered a significant contact.
Thanks for that explanation. Next question is, when you say artistic bubble, how does it translate to company members, particularly to designers during tech who may be working on multiple productions at the same time? Are they not allowed to go into their design studios or site visit other theaters with whom they may be working at the same time as working on a production with Milwaukee Rep? Jared, I'm going to toss that to you.
Yeah, so basically the time that we're looking at is really just from the designer run through in the rehearsal hall through tech. So it's fairly limited. Folks are going to be here on site. We do have the first batch of designers that we're working with. We have one staff member who's designing, as well as one local designer and 2 folks coming in from out of town. So we're going to encourage everybody to maintain that bubble as much as possible. But I think, you know, there will be some potential for folks to go into other buildings in the off time, but that time frame that we're dealing with is fairly short. So I think we can mitigate those as much as possible through, again, the use of PPE with masks and physical distancing.
Yeah, and additionally, we are doing testing. When the designers are going to be coming on site to be working in our world here, they will be tested prior to coming. And if they're here for tech periods, they will be tested on the weekly testing schedule. Okay, this one I think will go to Phil. What companies do you recommend for third-party air testing?
Actually, the company we used was called 4 Elements Group, and so it's a company that I work with quite often. But yeah, that's probably the one. Truthfully, there's not many out there, so I get the question. But yeah, that's the name of it, 4 Elements Group. And if anybody has any questions, they can always reach out to me, or you could reach out to me. So hope that helps.
Great, thank you. Okay, sorry, the questions are moving around on me a little bit. Regardless of the building or the time of year weather, doesn't increasing airflow cause more possibly virus-laden particulate moving through the air?
So for that one, so the CDC recommends you bring in more outside air, and they say even up to 100%. Well, we know that most buildings were never designed to do that. But what they're really trying to do is bring in outside air, because really it's about 2 things. One is the filtration. So when you bring it in the air, you're filtering it and getting those particulates out. And 2, what you're doing is the more outside air you bring in, the more you're exhausting. So basically, what they don't want is you recirculating the same air throughout the space. Even though you're filtering it, it's better to bring in the fresh outside air. So that's what their recommendation is, and that's why they say that.
All right, Dr. Neufeld, this one's for you. Are there any risks to wearing a mask for 8 to 10 hours a day?
I'm not exactly sure, exactly how to answer that. I do it every day. My wife is a physician. She does it every single day. There's a lot of people. So I think if we're looking at, is there a risk of, increased infection because we're wearing a mask? No. There's a lot of things on social media and elsewhere. And this is a big argument out there, which certainly this is not the forum for diving into all that. But bottom line is, as far as a respiratory problem, no, this isn't going to drop people's pulse ox and all this. We just aren't seeing this. I mean, I check pulse oxes on patients, I don't even know how many times a day, while they're wearing masks, and we're not seeing big drops in that. Certainly there is a risk if somebody is wearing a dirty mask, and if you don't wash your mask or change your mask or use the same mask every day for 2 weeks, yeah, that could certainly be an issue. Certainly the recommendation is to, hand sanitize before you put your mask on, hand sanitize before you take your mask off, and then hand sanitize once it's removed. So really these procedures help to eliminate any possible danger from wearing masks.
Great, thank you. Jared, I'm going to throw this one at you. How are you handling contact tracing within the company?
Yeah, so, again, I'll go back to our entry procedures. So if folks come in, one of the questions that they're asked is if they've experienced any symptoms of COVID at that point, which they will then be asked to leave the building and seek medical care. If any of our employees do happen to come into contact with someone with COVID, we are requiring them to isolate until they can test negative. I can share that this has happened to me. I thought I might have had a potential contact with somebody who could have been COVID positive. I got myself tested. I made sure to isolate and stay out of the building for that 14-day period. But we're in constant communication with our staff. They know the policies and procedures that we have in place. And if anybody does come down, if they came back with a positive diagnosis, we would then go back through the logs that we have to identify, as Dr. Needfeld said, anybody that they came into close contact with and work through the testing protocol there.
Yeah, we definitely have had some significant conversation with Dr. Neufeld and following health department guidelines on what that significant contact is. And certainly any exposure that anyone has, we would ask them to think about and list all the people that within the organization that they've had significant contact with, as well as all the places that they've been within the organization, so we can make sure that those areas go through more extensive cleaning. All right. What precautions are being put into place for local artists and stagehands who may not live close to the theater? What about stagehands, et cetera, who may work at multiple venues? Is there consistency between venues?
We have been in contact with other venues here in town. Most folks are following similar procedures to us. I can't say that they're all exactly the same. But I'll just refer back to our entry procedures and trying to limit the folks that come in. Honestly, as we talked about before, with the scaled back nature of scenery, lighting, most production elements, we're looking at employing a smaller workforce of people to get the job done. And most of this work is going to be able to be handled in-house with our resident crew members that are here with us day in and day out.
All right, well, I'm going to wrap up this webinar here. If we weren't able to answer your question tonight, or if you have any future questions, I'd like to tell the attendees to please contact us at 414-224-9490, or you can email us at tickets@milwaukeerep.com. Also, you can find more details about our health and safety plans on our website at www.milwaukeerep.com. I want to send a special thank you out to our panelists, Jared Clarkin, Carl Mueller, Dr. Mark Neufeld, and Phil Vetterkind for joining us tonight. And also to extend a very special thank you to all of the attendees who joined us from near and afar tonight. We hope that you stay safe, and we look forward to seeing you back at Milwaukee Rep soon. Thank you.